Namaste. Welcome back to my channel Food for Thought. Today we will discuss, can the second generation of COVID vaccines be the final silver bullet for this pandemic? We will look into this through four key points. First, we will see how the virus is spreading, how coronavirus is spreading. Second, we will see why herd immunity cannot be a moral or an effective solution. Third, we will see why the second generation vaccines could actually finally end the pandemic. And fourth, we will discuss what are the ways to handle the pandemic in the interim. If you like my content, do give it a thumbs up, please subscribe below and click on the notifications icon. Now we come to the first point, how COVID is spreading. There are two primary theories. First is through fomites and second is through aerosol. Now fomite transmission is actually the virus laying on surfaces or inanimate objects like say the doorknob or say lift buttons, and someone contacting the virus from those surfaces. Recent studies have shown, although fomite transmission happens, but the effect is actually far exaggerated. The virus typically under normal circumstances doesn't last too long on surfaces. However, aerosol transmission or transmission through droplets is the main way through which the virus is actually transmitting. And although the conventional theory says it can travel only 6 feet, sometimes we have seen in closed areas such as restaurants with ACs on, the virus can actually travel 8, 10 or even 20 feet. So this is how the coronavirus is primarily spreading. Now we come to the second point, why herd immunity cannot be a moral or an effective solution. Herd immunity is when a significant amount of the population is actually already has been contacted with the virus, and it is difficult for the virus now to jump to fresh new cases. In case of COVID, it is said to be 70%. So if like 70% of people are affected by COVID, it is likely that the pandemic will not spread further. But it's not a moral solution to go for herd immunity, because for the 70% of the population to contact COVID, many more will die. Official data from WHO recently said that most probably 1/10 of the population has contacted COVID. That means 90% of the population is still vulnerable and lot more people might die. So herd immunity is definitely not a moral solution. Also, just say 70% people have contacted COVID, but newborn babies will be born without immunity. So after a few days, again 70% threshold will get decreased because the newborn babies are actually not born with the COVID immunity. And of the people who have contacted COVID, we don't know for how long the antibodies will last. So that's why herd immunity might not be a very effective way. Now we come to the third point. What are these second generation vaccines? Well, these vaccines are the vaccines which will come at the later stages of 2021 or early 2022 with a significant amount of research. The vaccines that are coming out now, or say in the next year or so, say in early 2021, they are the first generation vaccine where the research has been pushed and speed has been given more importance than impact. For the second generation vaccine, the entire focus will be on impact. That is, how much effective will the vaccine be, for how long will the immunity last. So although first generation vaccines might come up very soon, they might not be that much effective. The second generation vaccines which will come after them, they will be very effective, and we need to keep one thing in mind. There are logistical challenges. For example, how many doses of the vaccine is required? Is refrigeration required? If yes, what will be the logistics of the refrigeration? So even after the second generation vaccine comes up, there would be a significant time for the world to get vaccinated with a proper vaccine which will give you immunity for very long. So in the meantime, how we should handle the pandemic? That's our fourth point. Now we should handle the pandemic through four key ways. One is, people should be aware that a pandemic is at bay and everyone should wear masks, they should wash hands and follow all precautions. One is public awareness. Second is government helping through economic reliefs. Third is treatment. We have seen tremendous improvements in treatment, and ICU deaths have come down by 30 or 40%. That is, people who are admitted and then who move on to ICU, people who are dying, say in March or April, that percentage has come down by 40%. So that means that the doctors have found a good treatment for COVID. They are not curing everyone, but many people are coming out of ICUs. That's good news. And the final thing is testing and contact tracing. Through these 4 key points, we should handle the pandemic till the silver bullet comes up. The silver bullet being the second generation vaccine. The first generation vaccine, as I mentioned, we don't know how long the immunity will last and how much effective it would be. Now I would leave you with some data of testing. I will pick up Bengal because the festive season is coming up and every one of us are gearing up for Durga Puja. You can see the chart in front of you which shows Bengal, which has a population of 10 crores or 1000 lakhs. The data is in lakhs. So population is also shown in lakhs and tested also is shown in lakhs. So West Bengal, which is a population of 10 crores, has tested till 13th of October only 37.75 lakh samples. However, UP, which has double the population of Bengal, has tested 1 crore 22 lakhs. Bihar, which also has the same range of population of Bengal, has tested 85 lakhs, 85.72 lakhs. This means Bihar has tested more than double of Bengal with the same population. And UP, Bihar are really the poorest states. So I really feel Bengal should actually ramp up testing, especially with the festive seasons. And Assam is the last state which I have mentioned, which has less than one third of Bengal's population. And even Assam has tested more than Bengal. So with the COVID season around, I really wish that testing ramps up in Bengal and we all become very aware of the virus and we really take precautions. With this, I would let you think on it and we will see you again next week. Thank you. Bye-bye.